Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show off this case because there's so much to learn about this case, not only about how this process works, but about kind of some alternative treatments that can work and what are some of the pitfalls that can happen along the way. This particular case is this is Summer, and in general, Summer is missing two of her front teeth. So not the two middle front teeth, the central incisors. It's the next two teeth, the upper lateral incisors. And in Summer's case, you're going to see that pretty much everything went right. And we'll talk about, even when everything goes right, how this process looks. And so, one of the things that I want to start out by saying is Summer started this orthodontic journey a lot earlier. We were tracking Summer for a long time, and we talked about the timing of when to start this procedure or when to start orthodontics. And we actually delayed the start of orthodontics longer than most patients are willing to start. So this is Summer at 16 years old. That's when we finally got started. Most of my patients in this situation, when they're missing front teeth, are not usually willing to go through the years of 11, 12, 13, 14, 15 with some missing teeth and with some of the gaps that Summer had. And so kudos to Summer. She's an awesome girl and very self-confident. And she was willing to delay this. And there are some really great reasons about that came out of that. So just keep that in mind, that we started treatment at 16 years old. So let me show you a little bit more here. This is a close-up of Summer's teeth. And again, she has the two front teeth. She's missing the next two teeth. And so that's why there's some spaces in the front of her mouth. The next two teeth that you see right here and right here are the upper canine teeth. So those are usually in the third positions. And on her right side, which is the left side of your screen, she has the canine and then the premolar, and the molar, just like it should be. On the left side, it's the canine, and then this is actually the baby canine tooth, which is still present in her mouth. And it's still there because the adult canine came in the position of the lateral incisor and did not knock out this baby tooth. So then behind that, we have the premolar, and the molar going backwards. One other thing to note is that Summer had this really strong, what we call frenum pull. So we all have these attachments between our upper lip and our gums. And some people have very, very thick muscular attachments in these places, like Summer. And you can see this muscle come all the way down in between the teeth. It might be one of the reasons why she has a gap between her two front teeth, because every time her upper lip is moving, it's pulling and wedging apart these two front teeth. Of course, another reason why she might have a gap between her front teeth is because she's missing the next two teeth. So there's just not enough tooth to kind of occupy all the spaces. Here's a look at her upper teeth. Again, you can see the two front teeth, then the canine teeth. We've got some more spaces on her right side, which is the left side of the screen. This is the baby tooth over on the left side. And otherwise, pretty good alignment all the way back. So we started treatment at 16. This was kind of our goal, was that we were going to remove the baby tooth. We were going to pull this canine tooth back so that it abutted up against this premolar. Same thing on the other side. We're going to pull this canine back so that it abutted up to the premolar. We're going to push these front two teeth together, and we're going to consolidate space where she's missing the two teeth. And our goal is to consolidate about 7 millimeters of space, because the plan, as was established between me and her general dentist, was that we are going to restore the missing teeth with implants. Dental implants are great ways to replace missing teeth, and so that was going to be our plan of how to replace these two missing teeth. So here's what she looks like kind of in the middle of treatment. We pulled the canine teeth back. Again, this one is abutting up next to the premolar. This one is abutting up next to the premolar. We had already created our spaces of about 7 millimeters. One of the great things about when we do these kind of cases with braces is we can put fake teeth onto the wire. So these fake teeth occupy the spaces and they maintain the space. So they're maintaining 7 millimeters of space between the central incisors and the canines. Our treatment took about 2 years. It took about 2 years because there was a lot of movement that we had to do, but then we have to make sure that everything is just right. Because my job as the orthodontist is to set up her general dentist for success and set up there was a periodontist who worked in this case to place the implants. My job is to set this space up exactly right for them, to make sure all the adjacent teeth and the adjacent roots are in the right positions so that the dental implants, which are kind of like screws, can go into the bone, and then we can properly mount teeth and it can look good and work well and look good. So again, this is a frontal view of what it looks like. These are fake teeth. They're just plastic teeth that we have tied onto the braces to help occupy space. And it actually looks pretty good. So as Summer's going through treatment, most people don't really realize that she's missing teeth because these are looking like real teeth on the braces. Here is Summer when we finished. And of course, when the braces come off, those fake teeth come out. Now, we will often make people a flipper, so it's a retainer that has some fake teeth, but that retainer can come in and out. But this is what it looks like when you're done with treatment and you're missing 2 front teeth, and it's not always the prettiest look in the world. Again, Summer was an amazing patient and cared less about this than your average person. The flipper, the retainer that has fake teeth on it, is really not something that should be chewed on. It should not be something that you wear when you're eating your meals. But for most kids, they're not willing to take that out, and I understand that. I get it. But they do risk breaking the flipper when they eat with it in. I can't remember if Summer would take hers out or not, but I think she was comfortable in taking her flipper out. Here's some closer looks at what it looked like when we finished without the fake teeth in there. Again, a little close-up view here. The bite in the back is perfect. Bite in the front is set up perfectly. We've got 7 millimeters of space just as we drew it out. Here's what it looks like from kind of the tongue perspective. We have these 2 front teeth bonded together so that they don't drift apart into the spaces. And we've got those 7 millimeters of space on each side. Now, one of the things to notice is if you look at the kind of the bone around these canine teeth and then go into the central incisor and you look at where the lateral incisor should be, there's really less bone here. And so in many of these cases, you can't just put an implant right in here. You need to graft some additional bone. And so she actually did have a bone graft before the implants were placed. Now this is what it looks like after the implants were placed, and just so that we kind of keep you abreast on the timeline here, we started treatment at age 16. The treatment took about 2 years, just a little less than 2 years, so she finished treatment at 18 years old, and about 9 months later she actually got the implants. So in that 9 months she had a bone graft, she had the implants placed, she had teeth put on them, and so this is what it looks like fully restored. Let me show it to you from a different perspective here. This is the frontal perspective. This is a great job by her general dentist, great job by the periodontist. This is about as good looking crowns and implants as you could possibly get. If you look right around the edge of the gums, you might see a little bit of more gray hue of these gums right here than some of the adjacent teeth. That's the gray metal implant. They're titanium implants. And so you might be seeing a little bit of that implant kind of through the gums. But this is a fantastic aesthetic result. Kudos to Dr. Ross Fuller, who's a great general dentist here in town. He did this work. And kudos to his periodontist, who's in Richmond. But they really did a fantastic job. Here is Summer smiling. And, again, this is a beautiful smile. Couldn't really ask for a better result. But again, I want to highlight how many things went right here. All right, so number one, what went right? Well, we got a great result. We have crowns that look good. It is very difficult to match crowns to existing teeth. It's much easier, and in this case, to do, say, crowns on the 2 front teeth or veneers on the 2 front teeth. That way all 4 of the front teeth are fake, if you will. It's just easier to match it. It is very difficult to match a single tooth on the right side and a single tooth on the left side and have it look good. This is as good of a job as I see, and we have lots of great dentists in Williamsburg who are capable of this, but I don't always see this beautiful of a result with anterior crowns. So that's one of the things that went right, is she had a great team of dental professionals working for her, and she got a great color match and great result. But the other thing that really went right is the timeline. And for her to go from the start of orthodontic treatment to implants in her mouth in 3 years is really quite remarkable. And what's great about it is that the less time that whole process takes, then there's less interim time. So where she has that flipper, that retainer that flips in and out, less time that she has to go with after she had the grafting done, she couldn't wear the flipper, so she actually had to go around looking like this for a little bit of time. Now, it didn't look exactly like this. There was a gum procedure that was done to uncover, to take away some of the gums and to reduce that muscle pull. But she had to go without some fake teeth for a little while in the process. And so, again, it really took a very self-assured girl to be able to do that, and and I'm sure even Summer felt self-conscious about that. But that's one of the things that really went right, was how quickly we went from the start of orthodontics to implants being in her mouth. And implants can't be placed until growth is complete. So most people don't want to put implants in on a young lady until at least 17 years old. Again, Summer had those implants done when she was 18 or 19. And for boys, you don't really want to put implants in until maybe like 22 years, because boys can still be growing in their early 20s. And so it can be difficult to gap the time between the conclusion of orthodontic treatment and the placement of implants. And in those gap times, you have to have things that replace teeth. So for Summer to go so quickly from the start of orthodontics to the teeth was really, really quite awesome and remarkable. And again, she got a fantastic result. So again, I think the takeaway message here is that even when everything goes right, as it did in Summer's case, this is a tough process, and it can be a tough process to go without teeth, or with teeth that are on something that comes in and out. And so these can be difficult cases to manage. Whenever we have the opportunity, we try to avoid this. Sometimes we have the opportunity where we can close up missing teeth and make it look like nothing was missing. And we don't have to have fake teeth as part of our restorative solution. And personally, that's what I like to do if we have that option available to us. For reasons that I didn't go into, that really wasn't an option for Summer. Just the way that her teeth are configured, the way that her jaws are configured, it wasn't an option for us to do that. But whenever possible, I think it's a great idea for us to try to not have the plan include implants, and to see if we can just close up all of our spaces and make things look good like that. So hopefully this is instructive, and if you're in a position where we're debating what to do with missing teeth, I hope this case is helpful and shows you what a great result is, and so shows you what's possible when we do it this way. All right, if you have any questions, please, of course, let me know, and we hope that we can take care of you or any friends that you know that have situations like this. So thank you so much.